here. And then I'll fix everything. Hi, everyone. Just waiting for Instagram to go live. Give us 1 second here. Having some technical. There we go. Well, good morning, all. Happy Friday. Just setting up my windows here with Dr. Kira Smilek. I am so excited to have a guest today. And not only do I have a guest, but she's literally sitting next to me. I can hug her while I interview her, which is amazing. Hello, everyone jumping in. Hey, do me a favor, check my tech for me. Am I live on Facebook? Am I live on YouTube? Am I live on Instagram? Give me a yay, a thumbs up, something, a hello. Couple announcements. First of all, thank you, Susan. First of all, thank you to all of you that sent me a note yesterday when I posted that my voice was gone and I was going live anyway. You guys are so sweet. You guys are so sweet. Thank you. I'm feeling significantly better. We'll see how long. Now it's not about if I'll have my voice, it's how long will it last before it disappears. So hopefully all day. So one of the big things for feedback that I had from you all when I asked you, what do you want? You all said, we want you to interview somebody. And when I asked what topics you wanted, naturopathics was a huge one. Probably because a lot of you are mamas. And I know what it feels like to be a mama and go to the doctor and not get enough time to ask questions and trying to, I think, sift through all of the stuff that comes down the pipeline, especially online. You know, this is bad, that is bad, this is good. And then 2 weeks later, it's like, no, that's good, this is bad. And we're all left, first of all, being a parent's like, we never know what's right anyway. Like, I don't. Do you guys? You guys?
There's no handbook.
There's no handbook. And I mean, I just pray that my kids turn out okay, right? So then when we're inundated with all this information, it makes it really difficult. So I thought, what better way to talk about this than to bring on Dr. Kira, who is the owner of Natural Kid Doc, which is a naturopathic pediatric practice here in Scottsdale. Fun fact, we went to medical school together, graduated in the same class. We've kept in touch. She's amazing. She's become a wonderful dear friend of mine, and I adore her greatly. So I don't see any comments on Instagram. Can you guys do me a favor? I need to know if it's working. Otherwise, live Q&As don't work so well if I don't have a comment. I see you guys showing in, but I can't see if you're making a comment. Can you guys make a comment for me on Instagram? And then we'll dive in. Come on, you can do it. Hi, Erin. How are you? I see Facebook is working just fine. Brenda, I see you're out there on Instagram. Can you tell me this is working? Thank you, Brenda. Okay. A cough every so often. I swear I'm fine. You're good. Okay. So this is a live Q&A, which means you guys get to ask questions. Obviously, we're focusing a lot on kids right now in naturopathic pediatrics. But until I start seeing, you're not seeing me on Facebook, Steve? Well, you're seeing me on YouTube, huh? I have some others on Facebook. I'm good. Right, Susan? Right, Erin? So I'm going to wait for you guys to start asking questions. Please throw those in. But just on the note of so much information, like, do you have advice for parents on how to navigate that?
That's a great question. So I think one of the things I teach a lot of the parents when they come in to our clinic is, you know, really there's so much information out there and it's not all the right information. And I think that's the tricky part, is how do you know what is the right thing, the wrong thing? But honestly, the best thing I want parents to do is really gather as much information as possible and then find a trusted source. So I have parents actually come bring in, what are the questions that you have? What did you find online? Let's talk through it. Let's go through it. And there are a lot of other providers out there that actually will answer questions and to just kind of help you sift through and determine what is true, what is not, how do I make this decision, and what's the best decision for my child.
Yeah. I mean, it's so hard. Like, and I think one thing that I've learned is my gut instinct. I need to trust it.
For sure.
because I think so often we go to the doctor and we have this question and we've done our research
Mhm.
and maybe they don't give us an answer that supports that. And then we have this conflict where we're like, oh shoot, who do I listen to?
Correct.
Myself or them? They're doctors. They must know. Right? And sometimes it just doesn't align. And that's okay.
Yeah.
That's okay. Yeah.
At the end of the day, as a mom, you always, and dad too, you always have to trust your gut instincts. I will say probably, moms tend to just have more natural kind of gut instincts when it comes to their kids, but you absolutely need to trust that. And so I think that's the unfortunate thing in the conventional medical world when it comes to pediatrics now is, number one, you get very little time with your pediatrician. So you have no idea, what questions to ask, nor do you have the time to actually ask the questions. And then so often parents feel like they can't ask the question because they feel like they're going to get met with some pushback on something rather than just an educational piece. And I think that's the frustrating thing that we see a lot of parents that actually choose to move away from the conventional medical model and come to a more naturopathic or functional medicine model because they just want to have conversations about their child's health. They, they want to feel able to make the decisions for themselves regarding their child's health.
Do you guys feel that way? Any moms, dads out there? Like chime in. Do you feel like you go to the doctor and you don't necessarily get enough time with the pediatrician, or are there questions that you've wanted to ask them and you don't get to? Anyone? You guys are so quiet today. What's going on? What's going on? Speak up. Steve says, I love your piece with Chef Barry. Thank you, Steve. Hey, did you guys know that I started my little passion project, which is interviewing people who have amazing stories, that have overcome obstacles, that have learned throughout their life, like these little shifts happen that just put them in a different direction. And I started a YouTube channel for that. Chef Barry was my first interview. He was fun, wasn't he? He was fun. Brenda says they push for flu and HPV. Yeah. Do you want to, can you talk about HPV a little bit, or does that get too controversial?
I mean, I can talk you mean just about the vaccine in general?
Well, I think
the disease.
No. I think this is something actually that's brought up to me a lot.
Sure.
People ask about it because they have teenagers or whatever.
Yeah.
And the moms I'm typically talking to moms. I'm not trying to eliminate you dads, but they go in and a lot of the times they come back to me and say, gosh, the doctor's really pushing the HPV. Is this something that should be pushed? Like, is it needed? Is it required? Is my kid really going to get cancer? And those types of things. I know my opinion on it. And obviously there's certain words we can't use here on social media, which is a bummer, which is, by the way, why you guys should join my membership, because we have private Q&As on Zoom and we can talk about whatever you want. But so obviously you have to be a little bit careful. But when I looked at if you look at the Dr. Sears model, where it's like, look at the pros and cons, right, of every single injection and what's the benefit and the risk. Are there any, I don't even know what to ask, if it's just telling parents to trust their gut or understanding, like, is there a real true risk to that in a 12-year-old that isn't sexually active?
Right. Yeah. I mean, it really comes down to, I mean, the reason that it is recommended at such a young age is they're trying to catch children before they're sexually active. However, then that comes back to the educational piece. So if you are having open conversations, your child's learning about sex education, learning about, safe sex when that comes, then that's then mitigating the risk. So, yes, if your child's not sexually active, that risk for HPV is very low because we know it's a sexually transmitted infection. So the only risk of transmission is through sexual activity. Right. So yes, so that's where, again, that educational piece of talking to parents about, okay, well, what does that look like? Where is your child? What is the communication like in the home? What is the education they're receiving at school? Unfortunately, kids don't really receive very much education at school. So it is kind of up to us parents and healthcare providers to have those, tough conversations so that they understand. And I usually tell parents, if you're able to have those conversations and really focus on the education and the safety piece, then that could be something that maybe you decide you don't want to do for your child.
Yeah, and I think another thing that a lot of people don't recognize that maybe we should point out is not all strains of HPV are a risk for cancer.
Correct.
So we're putting all the HPVs in the same box, right? And yet it's marketed as, prevent cancer, which is not 100% true. There's aspects of it that are true, but it's a very small piece of a larger picture. If you guys have more questions on that or you want to talk about it, keep throwing some questions out, okay? Because seriously, this woman is full of knowledge, way more than me. And I'm not supposed to be talking a ton today. Look at me go. I have 2 girls, and I talked with my kids and waited and did give it to them at an older age, right? So I think timeline actually is a really important topic when it comes to injections too, because we're told we have to have them at these certain ages. I personally waited I don't do all of the injections. People, you guys all know that. But the ones that I did, I waited. I didn't do them right out of the gate. I didn't know that kid's immune system. I didn't know how they were going to respond. I didn't know what their risks or their development was. And so I waited, and I think it's okay to do that. In my opinion, it's okay to do that. Like, not trying to throw anyone under the bus. If you feel more comfortable doing it on the set schedule, then do it on the set schedule. But I think it's important to recognize that we do have a choice. It's not, medicine isn't always set in stone. These are protocols.
Yep.
I would imagine that you do a ton of varying timelines.
Yes. Yep. That's a huge piece of what we discuss with parents. And really our goal is we're identifying risk factors. We're identifying what is your child potentially going to be exposed to. How severe is that illness? And if your child doesn't have a risk of exposure at a certain age, could that be something that we change the timeline on? And every single child's risk factors are different because every single family is different. And so when we're talking about that, we're really identifying what are your child's risk factors? What is their likelihood to be exposed to something? How severe could it be? And that comes down to what's their family history? How was the pregnancy? How was the birth? What's your lifestyle like? There's so many factors that go into kind of making that decision. It's really not a one size fits all. And really the whole purpose of that is really to help parents feel empowered and educated in that decision that they're making. So that's kind of
empowerment.
Yeah.
What an amazing concept, right? Going back to the instinct as a parent, getting the information, making a decision, and then sitting in your decision, kids. Sit in it, right? I have so many people that say, oh, I didn't get that. Oh my God, I wonder, should I have? Oh, but in that moment, when you compare the information, it was a decision at the time. I have people now that say, oh man, I gave him that shot and I so wish I wouldn't have. Look, at the moment, in that moment, when you compared your options, that was the choice you made. You need to sit in it. It's okay. Like, life moves on. We can't keep living in the past, right? We can only live in where we want to go in the future and the decisions that we make right now, right? Is this resonating with any of you guys? Do you like having a pediatrician on here? You guys are so quiet. I feel like I should get up and dance or like do something, which is a wealth of information. They're probably just all sitting there listening to what they're doing.
We're just start talking about
and that's cool. I mean, I can ask questions. I got all sorts of questions. And Brenda says, which is the education piece you mentioned, right? So important. I think one of the things, and I talk about this all the time, Kara, is one of the things that we're losing in our society is like the family dinners, the sitting down, the talking to kids, the asking questions, the conversation. It's so quick for everyone to go to a phone or go to the TV. And especially when it gets busy and we've got activities and running around, we spend less and less time talking. And so it makes it harder for kids to come to us, I think, with questions and to have these dialogues with our kids. Would you agree with that?
I do agree. I mean, especially we know that screens are have a significant impact on a child's well-being, especially as they're getting older. But there's more and more research that's coming out that shows even at a toddler age, you know, kids that are getting exposed to a lot of screen time is actually changing the chemicals in their brain. And we know it's an addictive thing, and we see that. And so often, you know, parents are telling me that they can't get their 3 or 4-year-old away, or they have a huge tantrum when they take them away from the screen. And that's because it just starts so young, and then it progresses. And then you get to the point where you need to have bigger conversations with an adolescent or teenager, and they're so stuck in their screen, and you're losing all of that family dynamic, which is really, really important for a child to create a really healthy emotional relationship, you know, with the family, but also that's going to be important for their relationships as they get older too.
Yeah,
and learning how to do that. Yeah,
totally.
Absolutely.
And we'll be seeing more and more anxiety and depression in kids. And I think a lot of it is that we don't have these early conversations. We're throwing them into screens and things like that, right? I have a question here. Thank you for the question on Instagram, by the way. How long do you let the infant-led baby lead weaning before you finally say, okay, kid, I'm just going to start putting it in your mouth? Do you understand that question?
Yes.
Okay.
Yeah. So we're talking about baby-led weaning. So baby-led weaning is basically child-directed feeding. So when a child is getting to the point where you're introducing food, there's kind of two different ways. So you can either do traditional kind of you puree food, and then you're spoon feeding the child and putting into their mouth. Baby-led weaning is you're actually giving them pieces of the food prepared in a safe manner that they're actually picking up and then putting into their mouth. So they're directing the feeding. The trick with that is you just have to keep trying. Even if it is not working, you just keep doing it. And I have a lot of parents that will do a combination of both. So you can still do baby-led weaning and do a puree, and you put it on the spoon, and you put the spoon on their tray, and or at least assisting them in the beginning, so they're learning how to put it into their mouth.
That's a good idea.
But they're still practicing the feeding. Feeding takes time, and sometimes kids pick it up right away and they love it. And some kids, it just takes a few months, and it's just being very persistent and being very consistent with it. So every day you're offering, every day you're trying, do not give up. And maybe you do a mix of, you do some purees on a spoon, and then you also do, you know, a few foods on the tray that they can also practice picking up. Just give it time. It will improve. It will.
And how old is your baby? Let us know, because that may dictate too, right?
Sure. Yep.
I remember Shay, oh my God, like he was young. Like he was sitting up. He was definitely not crawling yet. And we would take him to this Indian food place, and we would order chili gobi, okay, which is freaking hot. Yeah. And our family loves it. And I would be eating it, and Tyler would be eating it. And Cameron at like 3 years old was like, oh, that looks good. And Shay just freaking eats it. And I was like, oh my God, what are you doing? Shay had no problem with feeding himself. He was like, I don't want this bottle. I am not an infant. I think he was born an adult. Like he was just like, I've been here. Like, I'm not interested in this. I want the food. And it was so funny because the waiter walks by and he's like, oh, he's
so shocked.
I was like, oh my God. 7 months. She's more interested in utensils.
Yep. That's super common at that age. And a lot of it is you just keep giving her the opportunity to practice. It's a lot of practice. The more that you do it, the more likely that they will be able to pick it up. Yeah.
That's a great question.
Yeah, that was a good question.
I mean, yeah, I'm trying to think which one of my kids was way more interested in the utensils. It probably was also Shay. He was like, oh, you're going to give me a spoon? That's cool. I'm just going to eat here and I'm going to throw it.
Yeah.
Personalities. If you have multiple children, you'll find that every single child is completely different. My boys could not have been, still to this day, could not be so drastically different in the way that they process the world.
Yep.
It's unbelievable. Unbelievable. We got a hello from cold Pittsburgh.
Oh, I'm from Pittsburgh originally. I was born there. Lived there the first 12 years of my life. So,
and then you went overseas.
And then then we moved to Australia. Then I lived there for 4 years. We went to London for 2 years. Then I went back to the States to go to college. And then we moved out to Arizona to go to medical school. So.
And I still always wonder why you don't have an accent. like some mixed Australian London.
Well, I know when we lived in Australia, I'm the oldest of 4, and we all had Australian accents except for my parents. My parents kept their American accent. But then when we moved to London, we went to an American school, so we got our American accent back. But my youngest 2 siblings actually kept their accent. And my sister actually still lives in London. I see her here. Hi, Kaylin.
I love you.
She just had a little baby, so she has a 1-month-old at home. But yeah, my sister still kind of has like a British accent now because she lives there. So it's kind of fun.
Funny. It's funny. I mean, you have a beautiful accent. Maybe it's just the meld of all of it.
No idea.
Oh wow, how cool! You're from Pittsburgh. There you go. We got someone from Las Vegas. Well, hello. Las Vegas probably has weather like ours right now. Certainly not the weather of Pittsburgh.
No.
We're sitting here. You guys can't see what we're looking at, but we're looking out. There's a huge window, and it's palm trees and a pool and sunshine. So yay to Phoenix, Arizona. I do see some questions over on Instagram, and I'm way excited for them. So let's see what we got here. Are there vitamins that you recommend giving babies? When do you start giving vitamins? My baby's 10 months and exclusively breastfed. She eats 2 to 3 meals a day. So yeah, let's talk about vitamins. That's a great question.
Good question.
Beautiful question.
Yep. So typically in infancy, especially if a baby is breastfed, a lot of times if I'm doing any additional supplementation, I'm actually doing that through mom, especially in the very beginning. If a baby is breastfed, you're eating meals, you really don't need any extra vitamins because between the breast milk and the food that they're eating, they're getting all the nutrition that they need. Now around, somewhere between 6 to 9 months, I actually start adding a DHA supplement for babies. DHA is a component of fish oil, and it's really important for brain development in babies. And majority of the brain development is happening in those first few years. So initially when mom is first breastfeeding, baby's firstborn, a lot of times I'll put mom on a high dose of omega-3 fatty acids because that actually helps mom in the postpartum period as well. But then as baby gets older and we're doing food introduction, I actually start adding, a DHA supplement in there for them to support brain development. And then from there, it kind of just really depends. Sometimes certain babies, depending on what's going on with them, sometimes we talk about their gut health. Some babies need probiotics, some babies don't. But in terms of like a general multivitamin, at your baby's age, you really don't. You're doing everything that you need to do. It's really not until after a year as breastfeeding, you can continue to breastfeed, but maybe baby's not breastfeeding as much. We talk about, do we need to add vitamin D at that point? But really our goal is to get most of the nutrition in from the food that they are eating.
There was a bunch of studies, I'm sure you're familiar with them, on probiotics during pregnancy to reduce the risk of eczema, all of those types of allergic type responses. And so if you were to give a probiotic to the child, would it be more so recommending it to them when they have conditions like that? Or because you're saying waiting until they eat, like how do they get that? How would they know if the microbiome might need that extra support to introduce the probiotic either through mom or into the food?
So that's a great question. So a lot of that kind of depends on, and this is where, I'm going back and talking through, okay, how was the pregnancy? Was there antibiotic use during the pregnancy? How was mom's gut health even before pregnancy? Because that plays a big role. How was the birth? Was it a cesarean? Was it a vaginal birth?
Okay, explain why that matters.
So why that matters. So during a vaginal birth, when baby goes through the vaginal canal, they're getting their first dose of probiotics. So the good bacteria, they ingest all of the bacteria in the vaginal canal. And that actually helps to just prime their immune system a little bit. That's the first introduction to bacteria. Then they will continue to get more good bacteria as they breastfeed. So that's one of the most important reasons that we're breastfeeding our kids too, is that it's actually supporting their gut function. And a baby's gut health, especially in the first year, really primes their immune system for the rest of their life. So we are learning so much more about the importance of the microbiome and gut health now. And we actually have tests that we can do sometimes on infants, and I've started to do a lot of them. So especially if I have a baby where it was a cesarean or mom's not able to breastfeed, or it was, a complicated pregnancy with, different medications and maybe multiple antibiotics, I'm actually running a gut health test on baby to really see what is their microbiome? Because it's really fascinating. We can actually
Unbelievable.
see different microbiome pictures, and then we support the microbiome so that we're actually then decreasing the risk that this child might develop asthma or eczema or allergies
unbelievable.
as they get older. And so now we just have so much more technology that we can actually do
Oh
that.
my God. I
It's great.
really wish that all of my clients as adults had that as a child.
Yes, I know.
Because I'm going in and testing it now. And after 45 years of, imbalanced microbiome and autoimmunity development and stress and whatever, it's freaking amazing.
Mhm. Yeah.
It's amazing.
Yeah.
I have a question about breastfeeding, but there's two others. So we're going to go for them first. Just remind me if we get a quiet moment. Okay. Oh, it's from your sister. How old are you able to identify food allergies or intolerances in breastfed babies? How do you determine this? And are they usually passed from a mother or like genetic or not necessarily?
So it depends. It kind of depends. So there are sometimes in babies, usually in the very beginning, you cannot tell. It really takes at least a few weeks for a baby to be consuming breast milk to really see, is baby going to react to anything that you are eating. But sometimes within a few weeks, you can tell. There might be certain things like baby's really fussy, or they have a lot of gas, or they're spitting up a lot. Or they're getting skin rashes. I've seen that.
Shay had skin rashes almost immediately.
And usually those are signs of, sometimes they can be actual allergies, but sometimes they can actually just be food intolerances. And so at that point, a lot of times I will work with a mom and say, okay, well, let's talk through your diet. What are you eating? And maybe we can take out maybe some of the bigger, allergens, depending on what they're eating. We have to be very careful because we don't want to restrict a mother's diet and decrease the caloric intake, but we also want to try to identify what are the foods that baby might be reacting to. Yeah. A lot of times I do see a pattern between mom and baby. So if mom tends to have reactions to certain foods, even if they hadn't recently had it and it's been a while, so even in their whole lifetime, if at one point in their lifetime they didn't do well with dairy or they didn't do well with gluten, that would be the time when they're breastfeeding. I would say, okay, keep those foods really, really low in your diet, because there is a chance that your baby may react to that because you have a history of reacting to that. And a lot of that also comes back to gut health and the microbiome balance.
And what if they didn't breastfeed? Right? So let's say that they went right to formula. Mom had an allergy to dairy. Let's just see if we can stump her. I don't think we can, but let's just try. So mom, I have an allergy to dairy.
Yep.
I get pregnant. I birth the baby. I don't breastfeed. Are there odds that my child will now be allergic to dairy?
It's possible. But a lot of that it comes back to the microbiome.
Yeah.
So if you're formula feeding, then that would be a time where we would do I use Tiny Health a lot. So Tiny Health is what I'll use for the gut test. I would do a test and I would look at the baby's microbiome. And there are certain bacteria and certain microbiome makeups that we know is going to increase the risk that child might develop a food allergy. So if we can address that when the child's an infant, even though they're on formula, we're going to significantly decrease the chance of that actually happening as they get older.
Yeah.
So
that's awesome.
Yeah.
That's awesome.
Very cool.
Great question. Okay. Let's see. Wow. Hi, all of you. I love these questions. Thank you for throwing them out. You guys are on a roll. All right. 10-month-old is eating 3 meals a day. What is minimum milk intake at this age? And when and how do you recommend beginning the weaning process? Oh my gosh, that seems like so long ago for me.
It was a very long time ago.
Oh my gosh. I was like just thinking, I remember thinking that. And that was like 16 years ago. That's insane.
And a follow-up question to that would really be, it kind of depends on whether you're breastfeeding or formula feeding. The amount doesn't necessarily change, but it's obviously a lot harder to determine how much your baby is taking in when you're nursing.
Yeah.
But the general rule of thumb is you really don't change the amount of milk that a baby is taking in, even when you do food introduction. So the amount of breast milk formula is staying exactly the same until you're getting about closer to 12 months. However, some babies just naturally start to take in less milk because they're starting to eat more food. So at 10 months, you're doing 3 meals a day. You're going to start to add snacks in between those meals. And so naturally, baby might take less milk in, especially during the daytime. And you just follow that. And then weaning, you don't want to focus on weaning until you're getting to 12 months. Once baby is 12 months, then you can decide, okay, number one, do I want to keep breastfeeding if you're breastfeeding? And if you do, it might lessen to maybe you're just breastfeeding once or twice a day, maybe morning, evening time, but throughout the day, you're giving food and water and not doing as much breast milk, or you're just kind of nursing very occasionally, not very often, because at 12 months, the food actually becomes the main source of nutrition and calories at that point. If you're formula feeding at 12 months, as long as your baby is growing well, and that would be something to confirm with your pediatrician, then you can actually wean baby from the formula and you can transition. There's lots of different options. Sometimes some people try to do like an organic grass-fed whole milk. Some people will do goat milk. Some people will do plant-based milks. It really depends on what's going on with baby and how much they're eating. A baby has to be eating a good amount in order to really start to transition off of the formula. But that's where we have that conversation. So up until then, you don't want to purposely decrease any amount of milk intake.
Yeah, that's great.
Yeah.
Great question.
Yeah.
Thank you. Do you have a brand of DHA that you like more? She's on an antibiotic. Oh, that's unfortunate. I'm sorry. That's always so hard into little babies because she was having GI issues after I had to be on an antibiotic after having mastitis. Yeah.
Interesting.
I had a friend that had that too. Yeah. You don't have an online store, do you? Or do you?
I do not have an online store. We have, no, not yet.
Why not?
Yeah, I don't know. I need to get that. I'm working on it. I'm working on getting some more of the information that's in my head out online to other people.
Here's what we're going to do. Tell me the brand that you would do, and I will put it on my store in the meantime. And then when Dr. Kira opens her store, we'll move you over there.
So we used to use, we've always used Nordic Naturals. They have an infant DHA. However, we have recently had trouble getting it. So I'm not sure if they're discontinuing it or not. We haven't actually figured that out. But generally, Nordic Naturals is a really good brand. You do have to be careful where you get your fish oil from because of contamination. Yeah. So, and it's a very clean, it's straight fish oil. So it's very fishy. But a lot of babies actually really enjoy the taste of it. So they take it very easily. But that's usually the first one we kind of go to. Yeah.
And you know what I'll do? My store is Total Health Apothecary. You can get to it from my website. I will, after this, I'll sit here with Kira and we'll add a couple DHA, infant DHAs to my store if they're not already there so that you can search them. Okay? We will do that. And then we're going to get her to open her own store and then we'll be over there.
She said probiotic. Right. Okay. Yes. So she's on probiotic after.
Yeah. Okay, cool.
Which is great. And that might be something too. And it's very interesting. And a lot of this information has come from, Tiny Health and the research that they've done, but they have found that we know that a baby's gut microbiome can change really quickly. So even just putting them on probiotics, even for sometimes a few weeks, can actually improve and really change their microbiome. So, in the past, we always were like, they just need to be on probiotics long-term. And actually, we're now learning that may not be the case. And now that we have the testing, we can actually look at what bacteria do they have. Maybe they actually don't need probiotics.
That's great.
And they only need it at certain times.
That's awesome.
Yeah.
That's awesome.
A lot more precision, medicine in that way.
I think I might have the Tiny Health test on my store already.
Oh, that's great. Yeah. It's a great test.
Obviously you have to have a physician that can interpret it, like someone like this.
Tiny Health is pretty good. They give you a lot of information on there. It can be a little bit daunting because it's a lot of information, but they do, that is one of the good things is they do provide consumers with information. And I do believe they also offer clinical consults too with a clinician. Mm-hmm.
But I'll make sure it is on my website for those of you that are interested in that test to at least talk to your doctor about it or get it done and then take it to them or call her office because she is amazing. How many doctors do you have now?
There are 2 other doctors, but we're bringing on another one in the next month or so.
Cool.
So, yep.
I love it. Mm-hmm. Okay. Thoughts on the latest claims about heavy metals being found in products, the vitamins, Redmond salt, protein powders. This is a great conversation for everyone, not just in infants. So I want to hear your take on this. What do you think about all of this?
Yeah. So, this is a real thing. And to be honest, we are exposed to toxins every single day. And so, it's not surprising that we're finding them. Now, some of these claims, like some of the amounts, when they actually go in and they look at it, they find that the amount was so negligible that it's not concerning.
There is a lot of clickbait right now. There is. And I have to say, like, a lot of this has been there forever, but it's a time where everyone's on the let's find everything wrong with everything train. Right. And there's a lot of clickbait. So I just want to interrupt with that. Like,
Yeah,
right?
sure,
Like some
absolutely.
of it is valid, but some of it.
Yep. Some of it is. And that's why I would not just take everything that you see in the media or anything and go with that, because you really need to know, really go into who did the research, who's testing it, are they doing other testing, and looking at it that way. We do know that with certain products, food wise, especially for instance, like rice cereal is a big one that we would always feed babies. And it's been this thing that we do in the US. Every baby gets rice cereal at 4 months of age. I never recommend that. Number one, because there's no nutritional value to it. Most babies aren't ready to eat at 4 months old.
Only mine.
Yes.
It was ready to eat at 8 weeks old and was like 30 pounds.
Yes, that's true.
And now is almost 6'4" and still eats everything.
Anyway. Yeah. So, but with, rice cereal, we know, because rice in general can tend to have high levels of arsenic. And that's just because it grows in the ground, and arsenic is in the ground. Again, we're exposed to heavy metals all the time. So the idea is, how do we reduce the over total amount of exposure to all toxins, whether it's heavy metals, whether it's chemicals? We are really looking at the overall picture of everything, because you can make yourself go crazy and you can go down the black hole of everything is bad and everything is toxic for my child. Unfortunately, the reality is that our kids live in a much more toxic environment than we did. And that's just the nature of the environment and our lives now. And so our goal really is, especially in your home, because that's really where you can make the most difference, is how do you reduce chemical exposures for toxins of all kinds within and around your home? Because we can't control the environment around us. We can control, the foods that we're eating, the products we're using in our homes. And that's kind of what I counsel parents on is, let's try to make the best options. It cannot be perfect. You cannot live in a bubble. We also know that's not good for us. We need to get exposed to a lot of things for our microbiome health. It's a tricky one, but not everything is terrible either.
Yeah. And like I said, I think it's a time where, there's a lot of investigation into our food, and it's on everything, right? Which is great.
Yeah.
And a lot of controversy and a lot of, well, I'm going to take this side and that side. And I think what we need to do at some point, and I'm hoping to see this year, is all of us just need to chill out a little bit, right? Because it's not good for our adrenal systems or our children.
No.
Really take the time to investigate fully and not give into the snippets. I call it like clickbait medicine, right? You get one headline and everyone's like, oh, I'm like, well, hold up. Like, did anyone read the study? Like, calm down. We're so quick to attack lately. And the bottom line is we are exposed to toxins. My desk is made out of wood, but part of it probably has particle board in it somewhere. There's a toxin, right? The blue screens cause problems as well, yet we sit on our phone all day, right? So all we can really do is control what we can control. And I had to let go of that as a parent. I'm sure you did too.
Absolutely.
When it came to school.
Yeah.
Because when Shay used to go to preschool, well, Cameron and Shay, Cameron was never an issue because Cameron always ate healthy food. Like that kid, like I said, he ate everything, still does. Shay would go to preschool and the snacks were goldfish crackers. And I was like, no, I'm not letting my child eat that. So I would pack up with his own snacks and they would follow my rules and they wouldn't give him goldfish crackers. When he went to kindergarten and first grade and whatever, and they start having birthday parties where everyone brings cupcakes and, processed this or that and blue frosting and whatever, I was like, oh my God, what is going on? How am I going to control this? And I ate myself alive. And I was finally like, you know what? I can't do this to myself anymore. All I can do is control what's in the home and educate him on how does he feel when he eats those, because he would feel really crappy. He would get stomach aches. He would get rashes. He would get, I don't want to say angry, a little snippy, little behavior issues from it. And still to this day, it's something I battle with. Right. And I'm sure many of you have a similar thing. And I think all I can do is, now I'm mindful of what toothpaste I use. Toothpaste is a huge one. That's something you use every single day and you don't think about.
Right.
I need to get our holistic dental friend on here. So trying to reduce all the little toxins, a laundry detergent that you wash the clothes in, like little things like that are the things that I started to say, okay, what can I do that makes a difference? And then what's within my control? right?
Absolutely.
Hot topic. What is your opinion on vaccines? Do you recommend all of them, some of them, none of them? It's so hard to say. We kind of talked about this in the beginning. So I do encourage you to go back and watch the replay for some of the chatter in the middle or in the beginning. But let's give it like 1 or 2 minutes, just a summary of how do you handle that conversation? I know you kind of already spoke about this, but let's just give her a quick recap.
I mean, I have this conversation all the time in my practice with parents. And really, it is a very individualized approach because there is not a one size fits all. What I want parents to really understand is I want them to understand what each vaccine is, what they're for, why we would do them, and is your child going to be exposed to this disease? Are they not? It really depends on so many different risk factors. And I'm going through and identifying what the risk factors are for each individual family because it's not the same for every family. So it really is dependent on what the family wants, on what the child's going to be exposed to. And that's kind of how we approach it, is looking at what's the best of both worlds, you know, for your child. And it really varies by family, honestly.
And I think it's a no judgment zone.
Right.
Like for me, I present the information.
Right.
And if my client is like, yeah, you know what, I really would feel better getting it, then I say, okay, well, do you understand the pros and cons of both sides? Do you feel well educated? Do you feel comfortable in your decision? And they say, yes. I go, well, then I am going to support you. If someone says, I don't want to do that, I ask exactly the same question. Do you feel like you've heard both sides? Do you feel like you've had an opportunity to ask all the questions? Do you feel comfortable with your decision? Yes. Okay, cool. Jobs as a physician, our job is to listen, to educate, and to support your decision. And I think we've lost that in medicine because it's like, well, the doctor tells you what to do and you just do it, whether you agree with it or not. And that is what's wrong, right? I have no judgment. I have some clients that are all pro-vaccine. I have some that are totally against it. And I have most who are somewhere in the middle. And I support all of them. It's not me to decide whether they do something or not. It's me to make sure that they've received all the information that I've been trained and I point them to the right sources. And I think that's a huge thing, especially with parents, because you do get very inundated. Your hormones are all over the place, right? You don't know what decision to make. And I think just always taking a step back. I even say this when some of my clients have family members, luckily not my clients lately themselves, but like have family members that maybe get a cancer diagnosis or something. And they just hear the diagnosis and they've already got them in the chemo chair. And I'm like, hey, it's okay to take a day. It's okay to not be on the schedule immediately. You can take a day. You can research. You can ask questions. You can, get your worries out so that you can make an educated decision and feel comfortable with the decision. The chemo will be there 24 hours later. It's not going to go away, right? And I think it's the same with the vaccine. It's like, well, you need to have it on month 3 on this date. Well, if you're not comfortable to make that decision yet, then take a pause, do more research. And then maybe you get it at 3.5 months. Maybe you choose not to get it. Maybe you decide to switch up the schedule, but that's okay. Like it's a no judgment zone. And I think there's a lot of judgment right now around should you get it, should you not? And I really think that's a shame in our society because as you're saying, everybody's individualized, right?
Yep.
Absolutely.
Yep.
All right. Well, we have pretty much run out of our time. So if you didn't ask a question, dude, you missed out. But what I do want to know, if you guys would take a minute to write a comment, did you learn something today? And was it a good conversation for you? Because I thought it was great having you here.
Super fun. I'm happy to do
Super
it
fun. Super fun. And just so you guys know, announcement, you're going to start seeing some stuff from my next masterclass, which is on February 20th. It is on autoimmunity. And this was also from your feedback. We'll be talking about Hashimoto's. We'll be talking about celiac. We'll be talking about lupus, rheumatoid arthritis. So many people come to me and say, what can I do to reduce my autoimmune flares? How can I avoid a genetic transition from having a gene into getting autoimmunity? We are going to be diving into autoimmunity. So if this is an important topic to you, keep a lookout for the upcoming masterclass. You can actually join the membership now if you're like, I love masterclasses and I want to be part of a live Q&A that isn't on social media. but it's just with me. My membership, you have access to all masterclasses, including the past ones and all the future ones. And we do live Q&As. So number one, check that out. You can find it at drpingle.com, or you can wait if you just want to attend the one masterclass. I'll have some stuff coming up for that. Great conversation. Please do more. Absolutely. We'll get Kira on my other show at some point too.
Yeah, absolutely.
Because,
For sure.
because I think knowing her as a personal person and all of the amazing things that you've done and the mindset shifts you've done in your life, I can't wait to just dive into that with you.
Yes.
My little introvert friend, and is gonna get there and just get into her soul. But great conversation. Was nice to just listen on in. Yeah, you guys were kind of quiet, but I think they were listening.
Yeah, great. Yeah.
Which is great. So thank you for taking the time out of your day to be there with me. My voice held up.
Yeah.
Solid. Still not perfect. It's getting there. But thank you for being here, and we'll see you next time.